Hello viewers, I am Dr. Shailesh from Shekar Hospital. Today I would like to talk to you about visual disturbances, how do they appear and how to treat them and how to recognize them depending on the age group. So these visual disturbances come in various forms and various time of the day and at various age groups. I would like to touch upon at different age groups how visual disturbances can cause problem to the eyes and the person. Like in a young age, in children, because of the refractive error, those who are wearing glasses and all. So those people who have uncorrected refractive error, they have blurring of vision. Then those who have any trauma or injury unknowingly in children, children not tell. So they can have visual disturbances in the form of blurring of vision. Children won't say, or some opacity on the cornea, that the black portion, or they can develop secondary glaucomas where they can have pressure rise and then cause visual disturbances. And also children can have amblyopia, what is called as lazy eye, where right from childhood they will be having some glass number or some media opacity which is not treated. They develop amblyopia, lazy eye. That's also a part of visual disturbance. If it is treated on time, you can get back the vision in amblyopia, in children especially. Now this main visual events in children. Now in adults, there are different structures in the eye. Parts of the eye, this is the cornea, this is the retina, and this is the nerve. So in cornea, many times they will have conjunctivitis or red eye and they develop all these white opacities later on in some patients, and they time to time they flare up and cause visual disturbances, blurring of vision. And in some patients, they can develop severe rise of eye pressure or glaucoma, what we say. Then they call corneal haziness, and that also causes blurring of vision. In some situations, in the retina itself, there can be swelling in the back of the eye, that is the retina or the macula, what we call serous retinopathy. That also causes visual disturbances like a central scotoma. The visual disturbance comes in various forms and shapes. We have only side vision being gone, or overall diffuse haziness, or only the central part of the vision is gone. So these are the different types depending on the different type of structures that are affected in the eye. So in young adults who are type A person is what we call, like they have very tensed or they are very much stressed out. Young individuals who smoke, drink, and they travel a lot and too much of work pressure and all, they tend to develop this fluid in the retina and cause visual disturbance, especially in the central area. That is one thing, and they all are treatable if you recognize that symptom and visit the eye specialist and get it treated. The other issues is because of trauma in young children, young adults, sports injuries and all, they can cause traumatic retinal detachments or some other issues which can cause vision blurring. In young individuals also, we have some headaches kind of a thing regularly they have. That is also one of the symptoms. Like patient will tell that I can't see clearly sometimes, or there will be different stars or different images coming, followed by headache. This is called migraine kind of headaches. So that is one type of visual disturbance that is seen in a migraine or headache kind of patients. In some people, they will have one-sided vision loss, like some quadrant of the eye, they will not be seeing on one area, on the either right or left or up or down. So these people can sometimes have giddiness, vertigo, what we call the revolving of the surroundings, or when you sit up and get up from the sitting position, they get headache, giddiness. So some neurological issues they can have. They also have some visual disturbances. Best thing is to visit your neurologist or eye specialist and get it checked, because many times something in the brain can cause pressure effects and on the nerve and then cause visual disturbances. So that has to be evaluated and that has to be taken seriously, especially if the symptoms of vision persist for more than a day or so. So those who have any visual disturbances in the form of any one quadrant, weakness of the eyesight, or any giddiness or imbalance and all, should visit the eye doctor and a neurologist opinion. The other issues are those who are taking on medications, like some drugs. Regularly, a lot of people take, like for tuberculosis, they take ethambutol and all. For headaches, migraine, they take tamsulosin. They take so many other drugs which can cause acute attack of glaucomas. And in anti-TB tuberculosis drugs, some of them can cause problem in the retina, the pigment changes. So they cause damage to the certain structures of the eye and cause blurring of vision. Those things can be reverted once you stop the offending drug, or once you taper it or reduce the dosage in consultation with your physician. So one is the drugs also can cause some visual disturbances. Then the disease itself can cause visual disturbances. Now coming to the old age, to more than 50, 60 years of age especially, those people also tend to have visual impairment. Common cause will be the cataract, that is the lens, the opacity in the lens. So they also can cause opacity. In some people they have a central opacity, even young people, that will cause lot of glare. So while driving or while watching a bright light, they cause glare and cause almost blinding effect for them to while driving. So they can have a central posterior subcapsular cataract, one type of cataract we see, that also can cause visual disturbance. And in old people, definitely they have this cataract developing as a part of aging process. So they also have vision problem. First they will have long distance vision disturbance, then the reading activity also becomes impaired. So that once you remove the cataract and implanting the lens, you will feel better and you will see much better afterwards. Then in old people, we have visual disturbance in the form of retinal problems, that is called age-related macular degeneration. So our maculopathies, they will have some problems in the retina, that also causes visual disturbance, and that has to be treated on time. There is a fluid accumulation now. And one more set of patients are diabetics and of course hypertensives also. They can have bleeding or swelling in the retina and cause visual disturbances. And if they are recognized and treated early, they can get back the vision easily. Otherwise, we land up in so many other consequent problems and complications, which becomes more and more difficult as the disease progress. So, recognizing these visual disturbances and treating them early also becomes very important. In glaucoma, what we see is usually the peripheral vision is gone and the side vision, the patient not recognized in the early stages. They recognize only when the vision becomes so close to the central vision. That is what one more type of visual disturbance which patients fail to recognize. That's why any small doubt of visual problem the patient or the person has, please immediately report to the eye doctor and get it checked, verified that all things are normal or not. Otherwise, you will land up in a further serious eye-related problem which becomes more difficult if the problem is on an advanced stage. Thank you.